I am contacting you because I have so many health issues from a mild fatty liver. Okay, a mild fatty liver. Now, what causes fats to accumulate in the body? Why would fats accumulate in the body? For no reason? Maybe you're eating too many of them? No. Acids. Acids. Remember, the lymph system is a lipid-based fluid. This is a lipid-based because lipids are antacids. Cholesterol is antacids. So I can tell you that fatty liver is showing that your lymph system isn't moving well in your liver. Well, if your lymph system, sweetheart, isn't moving well in your liver, where else isn't it moving well? Yeah, head to toe. Head to toe. So, sweetheart, you focus on your lymph system. I take it you're a female. If you're a male, I love you too, man. Unexplained, here's a borderline hypothyroid. Okay, perk it up. Perk it up. Again, lymph can suppress thyroid. Lymph suppresses functions of cells. I can just tell you, the lymph, blood doesn't suppress anything. The lymph is what suppresses the function of cells. So that's the key factor. Pop that up. You could be backed up in the lymph in the head. The same thing with Jeremy here. You could have a suppressed pituitary, things like that. But go after the body's health. Don't be afraid. Step into this. Your body's going to respond to where you take it. Your body's going to follow you where you take it. Okay? And you're going to take it down the road of Wellville. And this is true for this guy with Lou Gehrig's or anything. You've got to take your body where you want it, if you've got the time. Unexplained hypertension with dizziness. Now, this is a good one, guys, and I talked about this yesterday. I think it's going up today, but unexplained hypertension, that's this. That's swinging blood pressure. 1 minute it's up, next minute it's gone. What is that? She has associated dizziness. Right there is the answer. Cerebellum. This is all cerebellum here. Wait a minute, right here's the thyroid. We have cerebellum congestion here, maybe inflammation. We'll use the word inflammation. We know it's acidosis. We know when the lymph backs up, pressure builds up, and so that pressure is going to also, you're going to see some tight necks and shoulders, sweetheart, and that depends which side, which kidney's draining. So it's all about your kidneys and adrenal glands always, and moving that lymph even out of the brain here. Get this drain, get your sinuses. It's suppressing your thyroid, maybe even your pituitary, but this is an easy catch. This is the cerebellum. This is flipping blood pressures like that. And the dizziness, that's your dizzy center, your equilibrium and vertigo center. So that's good. Weak digestion, can't digest vegetables and fruits. Well, super chew your fruits and get away from vegetables. And if you have to, juice your vegetables, super chew your fruit. Get your digestion going here, put yourself on a pancreatic formula. Because if your liver's getting fatty, so's your pancreas. It might not be getting fatty, but it's inflamed. It's acidic. The lymph is backed up even there. Could be suppressing digestive enzymes and the like. So get that pancreas up there. Tight back and chest. Oh, there you go. Tight back and chest. That's your lymph. You're tight. Your lymph is locked in you, sweetheart. You've got to get that lymph moving. And easier said than done, but focus on those adrenals, focus on those kidneys, honey, and and the lymph system. So there's the formulas. Definitely get into the colon. Remember the Fab 4 we talked about. You can use that Fab 4. I'd also grab a liver formula and a pancreatic formula. To save money, you could do 1 bottle of liver, gallbladder, 1 bottle of pancreas, 1 bottle of liver, gallbladder, 1 bottle of pancreas, and walk yourself down that line. All fruit, chew, super chew. Digest here more than down here, and work your pancreas back out of this. A lot of the liver herbs, however, will touch over and help the pancreas. Not really vice versa so much, but in a lot of the liver herbs will reach over and help the pancreas, so you'll be good in that way. Don't be scared here. You're real tight. You're real tight, but this is your lymph system, and this can become serious if you don't get this moving. These are acids. You're already lipid depositing from the fatty liver issue, but that'll come right out of there. You can fix all of this. Fix all of this. This is nothing. The radii solaris. Interesting that you mentioned that. Well, if you have radii solaris, these are black lines or dark lines that radiate out of either near the pupil or just in the bowel ring, just about a ½ inch or so around the pupil. These radius solaris are deep rings. There's no question about it. These are deep weaknesses. It generally starts in the colon, the transverse colon, and radiates in the brain, and it depends how far down the genetic line you are to how deep they are and how far in the brain they get. These radius solaris, if they get too deep, you can pick them up on a CAT scan as a brain lesion. So this is real important. You want to use upper circulation. You're in a genetic downline. Remember I said you young guys are in trouble here. So you just got to fix these things. That's all it is. Get into that colon. Really got to get into the colon. That's one of the connective links to the radius solaris. You'll notice they'll come right down on the bow ring. And really get that out of you there. And you probably have one going right up into the cerebellum, probably more left than right, but who knows? Could be either side or both. But these are all fixable. This has nothing. They have nothing to do with leaky gut or parasitic invasion. I mean, that's some iridologist that hasn't thought outside the box. These are deep genetic weaknesses in cells, and have nothing to do with these parasites or leaky gut. Does mean you have some colon issues, no question, and also up in the brain. It depends how far those radii solaris radiate up into the 11 to 1 o'clock position in the eye. Let's see. I don't know. You go after this whole thing together. I've been to a few naturopaths that only stuck me on supplements. Don't tell me how to heal or diet, and I'm so frustrated. No kidding. That makes me sick about naturopaths. Now, even naturopathy has lost its way. That's why what I did is I took the principles of naturopathy, some of the principles of botanical medicine, and I lumped them into a program of wellness, of health programs that regenerate the body, and got people away from this ridiculous concept of diseases and supplements and things like this. And people don't have the money to even focus there, and it's a waste of time. And I've tried to get naturopaths, but they're the least people that come to me. Believe it or not, in my school, they're the least. I get more medical doctors, chiropractors, acupuncturists than I ever do naturopaths to my school. Get some, but not many. She's been in the ER every month because of her hypertension that jumps. You can't control this one, sweetheart. This is all about lymph pressure. There's not a thing you can do, and you don't want to take high blood pressure medications, maybe in a PRN, meaning when needed, but you wouldn't take a high blood pressure medication, a beta blocker, calcium channel blocker. If you're normal, then you'll really bunch yourself into hypotension. No, this is pressure in the cerebellum. You might see a little bit in the kidneys too from that, but boy, you're seeing a lot of it in the cerebellum. That's an easy pick on that. She's lost a lot of money seeking help from holistic practitioners. That's the sad. Like I said, there's a lady up there. Her first appointment is $800. Mine is $2. Unless you come in, it's $250 because I do your eyes and stuff. But if you call her for a question, it's $50. $50 to ask you a question? I think I'm in the wrong. I'm doing this wrong. Who's that guy that said I was a capitalist here a while back? You said I haven't got $100 for any time you view these. Maybe you quit viewing them. You know, we try. You know, we really scrape and try to help everybody. Thank God we do these herbs ourselves, and we can keep their costs down and that. And because I'm sick every day for 8 months, now giving birth, oh, my husband and my children suffering. Yes, I'm here to help you, sweetheart. You live in Hawaii. And you don't need to find an iridologist, but you can find an ophthalmologist. An ophthalmologist, most of them can take a picture for me. I get a lot of pictures from ophthalmologists. You don't need to dilate the pupil, anything like that, and send me your iris and I'll go over it. But I can tell you, you got to get your lymph moving. I don't care what the iris shows about what tissues are involved. This is how you get rid of fatty livers. This is how you get rid of all the tightness and stuff. This is how you pull the lymph out of the brain and how you get remedy, how you get stable again, all these things. If you're compromised with this radius solaris, meaning that these are deep genetic weaknesses, this is why you're focusing on regeneration of tissue. And I've said this over and over again. This is where man has to come to. Can't treat anymore. There's nothing. You spent so much money treating yourself and you're still in the same boat you were. And that's because their focus is totally somewhere off of this planet.